Now to your health, women's health in particular. Big news last week about hormone replacement therapy.
A new report in the Journal of American Medical Association indicates taking combined hormone replacement therapy, HRT, may increase the risk of dying from breast cancer.
It's a study that has a lot of people talking, so we asked Dr. Susan Terrell from Advantage Health and St. Mary's Healthcare to talk to us about what it all means and what you're telling patients. You know, I guess maybe we should start from the beginning. Who is likely to come in and ask you questions about it, or to start being potential to receive it?
Right.
This therapy.
A lot of women start to go through a menopausal period. It's called perimenopausal syndrome. It's a combination of usually hot flashes, sweating. There can be some mood changes. There can be vaginal dryness, changes in their sex life because of that. And so they're curious as to what is this syndrome and do I have it? And typically that's how the conversation gets started. A lot of women have tried over-the-counter supplements, black cohosh, and different things like that, and aren't getting symptom relief. So that's how I usually initiate, or sometimes they can be in for their complete physical exams, and we just start talking about some of these things, and if they have painful intercourse, or if there's different symptoms as far as their emotions, depression, irritability, and mainly I come in for a lot of night sweats or severe hot flashes, and they can and again they can range from hardly anything to severe. Right. Where they're in a business meeting and they're soaking blouses.
Right.
So.
Well, and you know, and it's interesting because I know we're all different as women, but is there an age where you really start to see women start asking you these questions? So in their 40s?
Late 40s, sometimes early 40s, you can get some kind of vague symptoms of occasional intolerance to heat or a little bit of insomnia. And it's hard because today's world we have a lot of reasons to have insomnia with how busy everybody works and things like that. So it's important to kind of dissect out, you know, what all the symptoms are together. Actual menopause, complete menopause, is after 12 months without menses. And typically you'll note that they'll start to have some of the other symptoms that go along with that once they're in that range, that age range. They say the mean age is around 50.
Okay. So you were saying that this is really an individual thing. What's right for someone else may not be right for me or Terry, you know, and part of that process is talking with your physician, your provider, about whether this is even right for you.
It is, because if you don't have the systemic symptoms of the hot flashes and the insomnia and the emotional lability, you really don't, you know, but you do have the vaginal symptoms. I mean, there's vaginal topical creams, there's tablets, there's different methods at which you can just get the estrogen mainly in the vaginal area for more sexual comfort.
Right. And there are several different kinds of therapies that could be prescribed.
Correct. There's estrogen alone, and then there's estrogen plus progesterone, which is the combination therapy, and that should be given to women with an intact uterus that are just simply going through menopause on their own or naturally without a hysterectomy.
Right.
And that's to protect from endometrial cancers and hyperplasia with the endometrium. So it's individual, and you really need to talk about what your risk factors are.
Are there people that shouldn't be doing this?
There are. The people that shouldn't be using it is people that has either an estrogen positive carcinoma in their past or some kind of estrogen receptor positive cancer, breast cancer history, someone with a stroke, someone with a blood clot, or dysfunctional liver disease really isn't a better candidate. Now, with that said, if the painful intercourse is debilitating your life as a young woman, let's say you had a hysterectomy and then developed a breast cancer, if the breast cancer was found very early and it was in situ, meaning it hadn't even kind of broke through the layer yet and it was a lumpectomy type surgery, there's even thought that you can replace with vaginal estrogen because so little, it's like 0.003% is absorbed. So there's not a systemic risk with something like that, or the risk is so minute that women can opt for taking the risk. And I tell women every day that, remember, when you get in your car to drive somewhere, that's a higher risk than hormone therapy, and it's really a benefit to risk ratio that you have to contemplate.
Right, and there are some side effects that come along with hormone replacement therapy. Some are maybe more inconvenient, and others may become a little more severe and significant.
Right. Sometimes you can have, your menses can start again, or some spotting menses. You can have headache. You can have breast tenderness is usually the one that I hear most is breast tenderness. But you really have to look at how severe are those symptoms too. You always have to watch and be cautious of blood pressure, stroke symptoms, depression, weight changes, and really kind of keep that monitored so you're taking the least effective dose of estrogen. If I have women that come in and they've been on a certain dosage amount for years, and it started with good intent, but then they kind of got lost in the shuffle.
You need to reevaluate.
I reevaluate and say, I think you're past the critical point here. Let's reduce this and see how you do.
Well, you've given us some good information, and it's definitely a good starting point for some people, to start that conversation or, to learn more. So we're going to connect all your information on our website.
The American Cancer Society, I looked up when I was thinking about doing this today, and they have a great breast cancer risk with hormone replacement therapy section on their website too. So that was
wonderful.
I thought that was really helpful.
That's great, and of course we'll get the information on our website, and also make sure you have a doctor that you feel comfortable communicating with. I think that's the starting point to any kind of successful health care.
We'll be right back.